Hey everyone, it's Jessica again. I am actually making this video to cover more facts about the cerclage, mixed in with a little bit of my personal experience. I already did one video covering my personal experience with the cerclage, but there were a few things that I forgot to cover, and I actually wanted to give you a website if you are wanting to know more about actual facts. And I will include the website down at the bottom below, and this will help you understand more about what the cerclage is. When a woman's cervix is weak, sometimes called an incompetent cervix, and I'm reading from this website, she is more likely to have a baby born prematurely because the cervix shortens or opens too early in previous pregnancies, such as myself. I had 2 pregnancy losses before, like I stated in my first video. In order to prevent premature labor, a woman's doctor may recommend a cervical cerclage. A cerclage is used to prevent these early changes in a woman's cervix, thus preventing premature labor. A closed cervix helps a developing baby stay inside the uterus until the mother reaches 37 to 38 weeks of pregnancy. So basically, it's like I said before in my previous video, it's hard for them to determine that you have a weak cervix without your cervix showing signs in previous pregnancies. So like I said before in my previous video, most of the time they will not perform a cerclage unless you have had previous losses, or in previous pregnancies your cervix has shown signs of opening prematurely. What is a cervical cerclage? Treatment for a cervical incontinence is a surgical procedure called a cervical cerclage, in which the cervix is sewn closed during pregnancy. The cervix is the lowest part of the uterus and extends to the vagina. Pretty basic. Why is a cervical cerclage used? A cervical cerclage procedure may be used if a woman's cervix is at risk of opening under the pressure of a growing pregnancy. So like I said in my past video, if it's weak, your cervix just cannot handle the weight of the baby. A weak cervix can be the result of history of second trimester miscarriages, a previous cone biopsy or LEEP procedure. I am not familiar with those. Or a damaged cervix by pregnancy termination, which I have never done that. When is a cervical cerclage used? The best time for the cervical cerclage procedure is in the 3rd month, between 12 and 14 weeks pregnant. I had mine done at 14 weeks. However, some women may need a cerclage placed later in pregnancy. This is known as an emergent cerclage and is necessary after changes such as opening or shortening of the cervix have already begun. And if they don't know that your cervix is going to act this way, they're not checking it routinely. So they could find out later on in your pregnancy that, hey, it's open, or there's cervical changes. We might want to perform an emergent cerclage. And an emergent cerclage is called emergent, I'm guessing, because it's after that period of 12 to 14 weeks when they normally would do it. It also says here that future pregnancies will probably also require a cervical cerclage. So that's what my doctor informed me about. He told me because I was getting the Cerclage with this pregnancy that 9 times out of 10 I would have to receive the Cerclage with future pregnancies. And in all real honesty, I am perfectly fine with that because I don't want to have to worry that something could happen. I would just rather do it anyways just to be on the safe side. What are the alternatives to the cervical Cerclage procedure? If changes in the cervix are found very late in pregnancy, or if the cervix has already opened up significantly, bed rest may be the only alternative. And I did bed rest with my last pregnancy, but after they had already found something was wrong, my water had already ruptured and there was no water left inside the bag. And without the water, the lungs cannot develop. I had talked about that in my previous video. So at that point, they did place me on bed rest. In fact, they actually placed me on bed rest inside the hospital. I had to live there until I finally went into labor. But at that point, it really wasn't going to help me any because I had already lost my water. I don't recommend bed rest. If you have to do it, even with getting a Cerclage, that's one thing, because some doctors like to do that just to take extra precautions. My doctor, like I stated in my previous video, he did not place me on bed rest after my Cerclage, and he did give me a week off work, and he told me to take it very easy for the first 3 days after the surgery, but he did not place me on bed rest. In fact, he said I could work, he said I could go to school, and just go about my daily routine, which I was really thrilled about because I had, like I said, been on bed rest before with my previous pregnancy, and bed rest is really just, it's hard. Especially when your fiance or your husband works 12 hours a day and you're home alone. And I would think, I don't have any other children, but I would think that if you're placed on bed rest and you have small children or any other children for that matter, it's kind of hard to be, you know, very strict bed rest because you have other children that are depending on you. You know, so you have to get up and cook, and you have to do this and send them off to school and just different things. So it's kind of hard to commit to that. And even though you want the best for your baby, life keeps going. So it's extremely hard, you know. And I know because the last time I was on bed rest, granted I didn't have other children to take care of, but my dogs, they require, you know, a little bit of care. I mean, I had to take them outside. I had to, you know, do things like that. I had to get up and feed them, you know, and just, I had to cook for myself because, like I said, my fiance works 12 hours a day, 5 days a week, sometimes 6 days a week. So it was not easy, and it was extremely boring. I mean, it was horrible. I was miserable. I'm going to be flat out honest with you. I was just miserable on bed rest. So hopefully with this pregnancy, I don't have to go on bed rest. Hopefully everything goes well. The Cerclage holds perfectly. My cervix doesn't show any changes, and I am just, you know, going to have a wonderful pregnancy, and it's all going to be a breeze. I just pray that everything goes like that. And in case you're wondering, I am 18 weeks and 6 days today. I just did my previous video last night, and I was, I'm sorry if you hear that noise in the background. That is my cats and my dogs downstairs playing with something, some kind of toy. Here on this website, it says, what are the benefits of a Cerclage? Cervical Cerclage helps prevent miscarriage or preterm labor caused by cervical incompetence or weak cervix. The procedure is successful in 85 to 90% of cases. You have no idea how that percentage, just that alone, made me feel so good, because it's like, wow, you know, that's great. I mean, that is a wonderful, how do I put this? That is just a wonderful percentage. 85 to 90% of cases, it is completely successful. Cervical cerclage appears to be effective when true cervical incompetence exists. But unfortunately, the diagnosis of cervical incompetence is very difficult and can be inaccurate. And like I said before, they usually will not perform a cerclage unless you've had previous pregnancy losses. And the reason for that is because they have to know that you actually have an incompetent cervix before they give you the cerclage. And even if they diagnose you with an incompetent cervix, they could be wrong, because just like it says here, it is unfortunately, the diagnosis of cervical incompetence is very difficult and can be inaccurate. So sometimes there are other problems that may cause you to go into preterm labor. You know, so like it says here, why doesn't every woman who has had a preterm baby need a cerclage? Only women with an abnormal or incompetent cervix can be helped by a cerclage. However, even with the help of a cerclage, other problems can cause labor to begin too early. Women who have had a cerclage placed will need to be checked routinely for other complications such as infection and preterm labor. Because even if you get the cerclage done, like my doctor explained it to me, you can have what's called funneling or tunneling, something, you know, I'm guessing it's where the bag can actually funnel around the cervix, even with the stitch still there. So, you know, and at that point, if the bag is still intact but they catch you funneling, they will place you on bed rest. So that is something I pray does not happen. You know, because it's really sad and worrisome to sit on bed rest and to worry the entire rest of your pregnancy about what could go wrong. But like I said in my previous video, you have to be careful about worrying and getting upset and just being scared all the time, because that is just going to create more stress on your body and in your mind and in your heart, and it's just no good to stress out. So just take it really easy and just pray and just be calm, cool, and collect to the best of your ability. What should I expect before my cervical cerclage is placed? Your medical history will be reviewed, a thorough exam of your cervix, including a transvaginal ultrasound performed by a doctor who specializes in high-risk pregnancies. Your doctor will discuss pain control options for the procedure. Let me just say this too, because I did not cover this in my previous video. They told me that after the surgery, I may have experienced a little bit of cramping, and I may want to come with some Tylenol, or they will prescribe me some Tylenol. I did not experience any cramping. I did experience light bleeding for a day and a half, which is completely normal. It was not enough to fill up a pad. It was very light, and it was from the stitch being placed on my cervix, so it's not anything to be worried about. But I did not feel any cramping. Maybe at first for like 10 minutes, but after that, it went away. I didn't experience any more pain. So I just wanted to do this video to help you know the facts a little bit more. And if you have any questions or comments, just leave them below. I'm running short on time, so I'm having to cut this short. But I will actually leave the link to this video down below, so you can check this website out for yourself. Okay? So don't worry, guys. Everything is going to be okay, and just keep your chin up and just keep praying, okay? I'll talk to you later. Bye.